Call the Bruce County Council meeting to order this morning and welcome everyone for attending. There's Ann. Roll call first up.
Councillor Buckle. Councillor Eady. Present. Councillor Eagleson. Present. Councillor Ingalls. Present. Councillor Jackson. Councillor McKeever. Councillor Smith. Present. Warden Tulin.
Present. At this time, I'd ask anybody from council to declare pecuniary interest either now if it arises down the agenda this morning. Next up, confirmation of council minutes.
I have a motion moved by Councillor Smith and seconded by Councillor McKeever that the minutes of the January 6, 2017 council session be adopted as circulated.
Were there any errors, omissions, or discussions from those minutes? Hearing none, all those in favor, opposed if any, that is carried. Thank you. Communications. You've seen the communications. Delegations this morning. We have the Hospice Palliative Care Solution for Bruce County. Update information. We have Lisa Penner and Scott Lovell here. Welcome. The podium is yours.
Thank you, Mr. Warden and council members, for inviting us here today. I'm just going to give you a high-level overview of what's happening around residential hospice planning, and then Scott's going to speak to Grey Bruce specifically. So my name is Lisa Penner. I'm the Southwest Lynn Hospice Palliative Care Network lead. And for the last 3 years, we've really been looking at palliative care across the continuum and how we can improve palliative care. I guess it would help if I didn't have that upside down. There we go. Okay. So in 2011, a document was released by the province called the Declaration. It's my Bible that I go by as I work through my role as Palliative Care Network lead. And the Declaration really identified that we need to look at palliative care as a system, as a whole. And we need to better support people with life-limiting illnesses and their family members. We need to improve their comfort, dignity, and quality of life and quality of death through their journey. And we really need to, as healthcare providers, no matter what sector you're in, look at a shared ownership and accountability for palliative care. And that needs to be across all care settings. When I say that, I mean hospital, long-term care, home and community services, and hospice. So what were the drivers that really got the province looking at hospice palliative care? The Premier's mandate letter identified palliative care needed to be a high priority across our province, as well as in 2014, the Auditor General released a report looking at palliative care specifically and outlining recommendations to be able to improve the delivery of palliative care. And so as I go through my work as a facilitator, I have 5 teams across the Southwest Lynn in each sub-region area, and we really look at how do we deliver those recommendations locally. So how do we develop changes and build our system locally in each sub-region to feed into the whole provincial picture. Only 30% of palliative patients that could benefit from palliative care actually receive that kind of care. That was out of the report in 2014, so that is very sad. We would like to see that obviously at 100%, and so in the Southwest we've committed to building on palliative care. So who should receive hospice palliative care? We've started an endeavor across the Southwest looking at early identification, and it's as simple as asking yourself as a provider. I'm a registered nurse, and so nurses and personal support workers and physicians and social workers need to be asking themselves a question every time they see a patient. And the question is, would I be surprised if this individual passed away in the next year? If the answer is no, I wouldn't be surprised. At that moment, they need to start looking at what resources could these individuals benefit from in palliative care. So why do we want to focus on palliative care? I highlighted some of those points, but it's also to reduce the pain and symptom burden of care. So often with palliative care, there's a lot of pain management that needs to take place, and we want to ensure those individuals are comfortable. We want to improve their quality of life overall, and for those family members who are going through that journey or experience with that individual, we want to make sure that they don't suffer from caregiver burnout. So we want to make sure we have the right resources in place. From a system perspective, we really want to look at how we use hospitals in palliative care. It's not the most appropriate place. 90% of individuals, when you ask them where they want to be during their palliative care journey, do not want to be in a hospital. It's not a home-like setting. They don't get their own bed and their pets at their bedside and their family members being able to come and go as they please in a hospital setting. So they would prefer to be at home. So we really want to look at reducing the number of emergency department visits because that's expensive to the overall system. We want to avoid admissions to the hospital if at all possible because that's what we hear from the people. They don't want to be in the hospital. This slide just shows the model of care. We used to have a model where palliative care started at end of life, and that is really the very last phase of palliative care. And so what we've identified in the last 3 years is that palliative care needs to start at the moment an individual is diagnosed with a chronic disease, such as heart disease, diabetes, congestive heart failure, for example. That's when palliative care planning needs to begin. And that way, if we can change that culture across our society, we can get the right resources to those individuals at the right time. This is just the provincial working definition and the World Health Organization working definition for palliative care. So it's really a not-for-profit healthcare facility, for residential hospice. It's a not-for-profit healthcare facility which provides specialized hospice palliative care bed services. It's a home-like setting, and it serves the residents and their family members. It provides that care 24 hours a day, 7 days a week. And then this identifies a 3-bed model and a 4-bed model, but a 4-bed model is really what we want to support across the Southwest LHIN because it's providing nursing services 24 hours a day, 7 days a week. And these are just some more points. I think everybody received these slides in advance. These are just some more points around the working definition for palliative care. It's really about looking at the overall system, the collaboration across all of the different palliative care services being provided, and the community residential hospice needs to ensure that facilities are, risks are minimized at all times. So we want a safe environment for these individuals. Currently in the Southwest, we have 3 residential hospices. Secura House in Woodstock, 10 beds. It's been open since 2009. The residential hospice of Grey Bruce, and Scott's here with me today. He's going to speak at the end. 6 beds and moving to 8 beds shortly in March. And the St. Joe's Residential Hospice in London, and that's currently 10 beds. We have seen such a need for hospice planning in the Southwest that we are planning for enhancement. So that will include, and I'm sure you've heard in the media, here in Perth we'll be gaining a 10-bed residential hospice, pending announcement from the Ministry of Health. And we are planning a 10-bed hospice in Elgin County as well. And then in Grey Bruce, our recent capacity planning refresh, we released it, it's on the LHIN website, we released it in November of 2016, shows that Grey Bruce needs a model that will be increased. So in Grey County, Chapman House will become 8 beds, and we need to look at a satellite model to ensure that we're meeting the needs of Bruce County as well. This kind of convoluted model is really just showing you what our structure is from a LHIN perspective. So we have a hospice palliative care leadership committee that's made of decision makers, leaders from all different sectors in palliative care, and they are really responsible for making the decisions around system design and capacity planning and learning and development, education, performance. And then the 5 kind of colored squares there shows the different collaborative tables that I work with. And so there you go by subregion: Oxford, Elgin, here in Perth, London, Middlesex, and Grey Bruce. And those are the groups I identified earlier that look at the local planning and local change ideas to get to the model that we're trying to build. And so really what my role is to facilitate between those 5 tables and the leadership committee to ensure that What the province wants us to do is what we're implementing in the Southwest, and that needs to be our vision and our goals. And then what does that mean locally in small rural communities? This is one of my favorite slides because I like data. So if you look at the far right-hand column, it will show you the capacity benchmark column. That's where the province wants to see us at. So when we completed the capacity plan, the first report that was done across the province, the Southwest LHIN identified how we were going to measure what our capacity needed to be for the future. Our results, if you look there for hospital, and I'm sorry, I do wear glasses, it's so tiny, but I think it's 49%, so almost 50% of deaths are taking place in the hospital sector. The province wants to see us at 25%. We're double. We have a lot of work to do. That many people shouldn't be dying in a hospital sector. And in saying that, there are definitely times when individuals need to be in hospitals, and we need to be accepting of that in our smaller rural communities where we have small community hospitals that have been the pillar of the community, and often they have palliative care beds, the suites that they've established within those small community hospitals. So how do we find that balance between that setting and what the province wants to see us at? If we look at home and community, I think it's around 11. Somebody correct me if I'm wrong, 11.4%. And the province wants to see us at much higher, higher than 20% for the number of deaths taking place in home and community. So we really need to start ramping up the services that we're providing in our home and community, and especially for palliative care, so that those individuals can stay in their home as long as they want to be there. Long-term care, we're doing quite well. We're at about 23%. I think the province wanted to see us at 25%. So we're doing very well with being able to support those in long-term care through their palliative care journeys. And then residential hospice, we're just over 4%, and the province wants to see us at 12%. The only way to get there is to increase our capacity for residential hospice, so that's what we're looking at. And this next slide, which I'm not going to be able to read you the numbers, but I think everybody had the slide presentation. If you look specifically at your community of Bruce County, you'll see where you rate, and the column right beside it shows that provincial benchmark column. So you have a high number of deaths taking place in hospital, and the reason for that is because you don't have the needed services in home and community, and you don't have residential hospice capacity. You utilize Grey County Chapman House. Some members do, but we identify that it's a far travel, and so many communities outside in Bruce County would not use that as an option. This slide really shows the methodology we used as we started looking specifically at residential hospice. So we applied the recommended benchmark populations, and it was based on the bed ratio of 5.1 to 6.8 beds per 100,000 population. That was right out of the provincial residential hospice working group report that the province released. It equated to a total of 49 to 66 residential hospice beds in the Southwest LHIN, which would represent an increase of 23 to 40 additional beds, because right now we're at 26. And so we looked at length of stay. Was that different between a 3-week length of stay and a 4-week length of stay? There was a bit of a difference. So we are very underserviced when we look at residential hospice specific capacity. So we then as a group decided to make some assumptions. So at some point we knew the province will identify residential hospice resources. So the Minister of Health announced 200 new capacity beds, and we had our arms up waving saying we want some of those. There's definitely a need to expand residential hospice beds in the Southwest in order to be able to achieve those provincial benchmarks that the province has set. We developed outreach teams. So in Grey Bruce, you have a palliative care outreach team. That team provides secondary level consultation, and maybe Scott, you can give a little more detail about the team. And in order to achieve the reduction of deaths in hospitals, we had to make sure we have the resources in home and community services, as well as in residential hospice capacity. And the deaths supported in long-term care, we've identified we're doing very well with that. So those individuals have the right resources in long-term care, and they have the right education to be able to provide that support throughout an individual's journey. We also looked at the need to ramp up on our education specific to palliative care. So we have two groups working on that. We have an education subcommittee who's looking at those who are already practicing in palliative care. How do we make them become experts? And those individuals who are going to school for healthcare professionals, how do we ensure they get the right education while they're in college and university so that when they graduate, they're feeling competent to provide palliative care? And then building the links between and the relationships between all the different teams that provide palliative care, because it really is a cross-sector service. So we've developed a future state model where we will identify when somebody needs palliative care earlier. We will have secondary level consultation outreach teams available in all subregions to provide support to home and community service providers. We will have residential hospice support in all subregions, so that is an option for communities, and we will ramp up on our education to build those experts. These were the 5 key LHIN-wide recommendations that came out of our capacity report in 2015. So we're in the process of going through establishing all of those recommendations in each community. This slide just walks us through the LHIN process for that. And really, what do we want around residential hospice? People have to provide a unified approach to care. It can't be separate solutions in small communities in isolation of one another, because that just won't work when we look at an overall system. We want to consider a delinked, decentralized model that's able to meet all the care standards. So satellites are acceptable. We want to look at partnerships and integration between the residential hospices, the volunteer visiting programs that are already established and functioning very well in communities, the outreach programs, the share the care models, so how do we provide support around communities, and bereavement support. And we really want to build centers of excellence. The next couple of slides, I won't go into a lot of detail. You can review those on your own, but it's really the LHIN's expectations around building partnerships and ensuring a unified solution for each subregion. So for Grey Bruce, it's a unified solution for hospice for Grey Bruce. And Scott, if you want to highlight what's happening locally.
Good morning, everyone. I will be brief-ish. I want to start by saying thank you. For the last time that I was here, I learned via Twitter on the way back that as a council, you'd agreed to donate $50,000 towards the construction of Chapman House, for which we're very grateful for. If it's $50,000 an appearance, I thank you very much again for the additional 50 today. And, oh, sorry. Anyway. I guess I am. I also want to thank the team at the Local Health Integration Network. I think that anybody that remembers the story of the formation and the foundation of the residential hospice of Grey Bruce, there was an element of struggle and contention with it. To get this service up and running in our community in one spot was a challenge enough, but over the past few years, the relationship has grown and almost done a complete 180-degree turn in terms of working together to see an expansion of service in this community. Specifically, when I think about the donation that you made, I consider it an investment in the future for a prospect of smaller hospices being opened up in these communities. We know that running a 6-bed residential hospice is harder than running an 8-bed residential hospice, which is harder than running a 10-bed because the funding that you get from the Ministry of Health and Long-Term Care is on a per-bed basis. So we know that a 4-bed hospice is going to be difficult for a community to sustain in no small measure because there's an obligation on the part of the community to raise some of the dollars to support the operation. The money from the Ministry of Health and Long-Term Care through the CCAC can only be applied to the salaries of the nurses and personal support workers at the bedside. So when we cite residential hospices, there's an obligation of the community to step up and support the work that's being done within there. I will say that I'm grateful to be from a community that has a couple of good prospects in the future. I think it's no secret that we're working with the communities of Brockton and Kincardine right now on what a model would look like that would see the residential hospice of Grey Bruce, soon to be Chapman House, helping support a smaller organization, sharing health human resources, the expert medical care that's necessary to make the care that's received in a residential hospice just that little bit different than what you would receive in a hospital or in a home-like setting. We've created capacity in the past few years in the space that we've existed, but we've also created the opportunity for growth in the future. I think that when Lisa mentioned things like the secondary level expert outreach team that we have in the community now, supporting frontline providers and primary care physicians in the community by offering to assist in cases that are a bit more challenging for people in parts throughout this community, is a good first step in helping export some of the things that we're learning from the hospice right now. But we're also seeing more physicians getting involved in palliative care and developing a further expertise in that as well. More palliative physicians in our community will only make care across all sectors better. So today, I'm proud to stand before council and say that the future of residential hospice care in this community is looking an awful lot brighter. I think there's acknowledgement when we work with groups like from Brockton and Kincardine that the next satellite beds, their permanent home ought to be in Bruce County, and I think that we're going to get there. But it's going to take a little bit more hard work on behalf of the groups who are submitting the proposals, and more work with the local health integration networks to see exactly how it works out. But I'm really excited to see the change in the relationship that has occurred over the past few years. We've been lucky to establish the service that we had and to have the success that we've had in terms of patient and family care in this community, but more excited to be able to move forward. I think this is the part where we'll do questions and answers, and I hope you ask Lisa more, because I played hockey till late last night and I'm still a little bit dehydrated, so forgive my voice.
Good, thank you, Scott. Questions from council for either Lisa or Scott? Anne?
Just more a comment. I'm really glad to see the level of cooperation that is apparent with both the LHIN and at the local level, and I know our community is working very hard, and I'm sure Brockton's is too, and I think geographically and population-wise, the satellite offices work well, and I just know on a personal note, when my dad was dying in 2009, his only options, and it was a long time burden to provide the 24-hour care needed, but were to go to London to the Veterans Place or to Thornbury. And so I think this is a real improvement that the LHIN recognizes and that it's recognized locally. So I want to congratulate you on your efforts, and if we can do anything in Kincardine to move forward, I know we have a very hard-working group.
A very hard-working group.
Just give us a shout. So thank you.
Thank you.
Good. Any other comments or questions? Hearing none. Oh, sorry. Kelly?
Through you, Mr. Warden, I do have a couple of questions in relation to the proposal or the presentation, if I may. If we could go back to page 13, and I suppose it's a question for Lisa. Looking at the very right side of the chart, and if I'm reading it correctly, it shows Elgin County with a recommendation of 6 beds.
Yes, so this chart that you're looking at right now is from the original capacity report it was released in July of 2015.
Right.
And then we just did a refresh. We committed, after we did the first one, because we were the first LHIN to go ahead with a capacity report, we saw the success of it and how it really helps support our planning moving forward. We committed to do a refresh every year, so we've just recently done a refresh. It was released in November by the LHIN, and that refresh identifies a higher number for Elgin County based on population growth. So in 1 year, they've already started seeing changes with their aging population, and the volume, so the volume of people who are moving or migrating to Elgin County. And also, when you're going through the building of a hospice, you want to make sure you're looking at what is the need now and what is going to be the need 5 years from now, because you don't want to build something small and then in 5 years you're going to need something bigger and you didn't anticipate that. So for example, and Scott, you might want to speak to this, Chapman House is building a larger residential hospice than 8 beds, but we will only be funding 8 beds. Do you have anything you want to add to that? So, but they already see, as our population grows, through our stats up to
Right.
2025, they see that the need's going to be higher. We have an aging population across the Southwest.
Right, and as does Bruce County, correct?
Yes.
Right?
Yeah.
So the chart had recommended 6 beds, and Elgin has received funding for 10 beds. Is that correct?
So they haven't received any funding yet. They're in the very preliminary stage. Elgin County has developed a residential hospice planning subcommittee, just like Grey Bruce and just
Right.
like here in Perth, but they've just gone out to tender for an RFP to do a feasibility study. So through that feasibility study, it will either confirm that the need may be 10 beds, or it may confirm that they may build bigger with a vision of 10 beds, but maybe only 6 would get funded.
Okay.
So they don't have any funding yet. And actually, just to clarify, here in Perth hasn't received their actual signed letter from the ministry, so they haven't received that yet. Grey Bruce has received the 2-bed increase letter, so they know that they've got that funding.
Okay, so the part where I'm getting a little bit confused, and pardon me because maybe I'm less knowledgeable in terms of how things occur, but I'm not understanding the definition of a satellite site and how Bruce County's population is going to get served in future, and what commitment is being made by the LHIN to fund the Bruce County need. That's where
Yeah.
I'm confused by this.
Yeah.
Okay. Not to jump in right away, but first I'll say this. Our hospice is currently serving residents from Bruce County. In the first couple of years of our operation, 50% of our patients were coming from outside the city of Owen Sound. This year, it's 2/3 have come from outside the city of Owen Sound. So we are talking about a service that exists in the community that is serving the region of Grey and Bruce. With respect to the discussion about satellite, I think the things that we need to look at when we consider operating a smaller hospice is health, human resources, administration, reporting structure, and not duplicating things that can easily be picked up by having a strong regional center. Reduce the burden of costs that a community is being asked to bear, and share those within a broader corporate structure. I think as well that when we look at these numbers, we need to imagine that even for us, if we didn't open in a temporary space, it would have been 3 years before we had a functioning freestanding residential hospice. The interesting thing about the presentation or the proposal that's going to be put forward by the groups from Brockton, Kincardine, and this community is that it envisions starting in a temporary location somewhere so the service is up and running faster. We always have the opportunity when these smaller hospices get established to evaluate the data that's coming in. But we know that if we have 8 beds in Owen Sound serving the region, if a satellite opens in part of Bruce County, it doesn't mean that the Owen Sound site is closed to the rest of the region. But I think that you'll find in communities like Kincardine or Walkerton that the uptake pattern will look a little bit different. 4 beds may be sufficient as long as they're supported with the 8, but we created Chapman House with the idea towards growth being a possibility, but also making sure that we didn't put too much in that one spot to preclude more beds in another part of this community. It's difficult. I think I get the direction of your question. I think that from being involved in this for as long as I have, it's a really good next step to consider a smaller hospice in Bruce County that is operated in cooperation with the Residential Hospice of Grey Bruce, just to make it easier on the community, pardon me, to sustain the operation.
Through you, Mr. Warden, I think I may follow up offline because I'm not sure I'm continuing to understand, so.
Okay, Ann.
Sorry, I just had one more question that, just in the dialogue here. So I know in Kincardine they do have a proposed temporary location. So then the thinking is that can be monitored and the progress made, and how much is the success of this temporary location affect, or is it just a stopgap measure at the time? Like how much, what's the importance or the effect of this temporary location? It's a lot of work, I think, to maybe set it up, other than you don't have to build anything, but you have to have all the processes and funding in place. I just wondered, do you start in a temporary location with 1 bed or 2 beds, or is it just a 1 bed thing?
Yep, so 4 beds would be optimum. The reason why we look at 4 beds and not a 1 or 2 bed model is with 4 beds, you have 24-hour nursing. Okay. Smaller models, it's very hard for a community to do the fundraising that's needed to provide 24-hour nursing services, not only just the nursing services, but looking at best practice, providing education, all of those components for those smaller 1 or 2 bed models. So we really, the LHIN, the leadership committee, the collaborative tables, we've had vast discussion on this, and a 4-bed model we feel is the most sustainable model long-term. And the other part of your question around opening up a temporary site, often communities will choose to do that just because it could be the timing of funding, and when the Ministry of Health makes an announcement, they often will say beds need to be open by X date. And so by choosing a temporary site, they can take their time if they want to look at what a build's going to look like. There's a lot of detail that goes into that. So I think that was part of the planning of the planning group.
Oh, okay. Sorry to ask you one
No,
more, but
no.
so is, for a temporary location, is 1 bed considered enough, or should it be 2? Or like,
4.
Or you really want the 4?
Should be 4.
It really should be 4 in a temporary location. Okay, thank you. I just
Yeah.
wanted to get that straight.
Yeah, because you've got to remember, you have to have a medical director that's an expert in palliative care that's going to be able to oversee, and nursing care that's going to be experts in palliative care that are going to be able to care for those individuals. So the model that we really support is a 4-bed model. So even if it's a temporary site, putting 1 or 2 beds here and 1 or 2 beds in a different community is going to be very challenging, because then all of a sudden you have to have staffing and resources to look after those.
Yes, and in winter especially, it's difficult to...
Yeah, and so I think where Scott was heading with his communication around Chapman House and the model is there are so many back office services that can be leveraged through Chapman House to help make a 4-bed satellite site efficient. So that's why we call it a satellite site. So it would be part of Chapman House, yes. And that satellite site would be able to leverage those back office services, such as your role like Scott, and laundry and best practices and policies and procedures. All of that information would be able to be shared within the organizations, and there's a richness and a cost effectiveness to that.
Okay, thank you.
Okay, so thank you very much for your presentation, and keep up the good work. So we're going to move on to our next delegation. We have Phil Englishman here, who's bringing us a presentation as well. Welcome, Phil.
Thank you, Mr. Warden, lady and gentlemen of County Council, staff. Thank you for allowing me to come before you. I'm excited. We've got Bruce County's anniversary. I heard about this last summer, and I thought, well, we've got to do something with a bang that get Bruce County noticed by all its citizens that it has an anniversary and the rest of Canada. That's why I invited the Snowbirds to come here. I'll show you the presentation of her inspection last week that we passed with flying colors.
They're doing a great job, and we're ready to go.
A team of local pilots are bringing the Snowbirds to the region to celebrate an anniversary, the country's and the county's.
It's a party. It's the 150th anniversary of Bruce County and also Canada. But Bruce County is more important than Canada. So we're celebrating Bruce County with the aircraft from the Canadian Forces Snowbirds.
The Snowbirds will be the centerpiece of an air show on June 21st here at the Saugeen Municipal Airport. The Snowbirds haven't flown here since 2004. It's the smallest airport they'll perform out of this summer.
The two aircraft Canadian design and built was built to work in airports like this. It handles magnificently, and it allows us to go to places that the big jet teams cannot.
Bringing the Snowbirds to your town isn't free. That's why organizers will be going to Bruce County municipalities and councils looking for financial support to help fund this air show.
I hope some of the councils in the area will support the show to pay for it. Otherwise, I'm going to go broke myself. Okay?
More aircraft will be announced in the weeks leading up to the show, but the main act is locked and loaded and ready to entertain. Near Hanover, Scott Miller, CTV News.
Anyway, I should introduce myself. I'm the chair, pardon me, I'm the secretary to Saugeen Municipal Airport. I'd like to introduce my co-chair, John Critchfield. John is also captain with the Air Cadets, RCF Air Cadets. And yeah, this came about, as I said, we had a dream of the summer. We want to have to celebrate Bruce County's anniversary with a bang. As the video says, it costs money. You can see the cost up there. The Snowbirds are celebrating Bruce County. I'm hoping that you can celebrate the Snowbirds by coming here, by helping us with finance. I don't know what your budget is, but I'd like you, in return for the Snowbirds honoring Bruce County, pick up the hotel tab. It's $7,900, $791. I'm raising funds through the community as well. Lovely Motors has graciously contributed 12 vehicles, cars, and a support van for the Snowbirds to do the show and get around. I'm trying to maintain all the business in Bruce County. The hotel has been booked in Brockton. I'm sourcing sanitation out of either Blue Water Sanitation or CNR Sanitation in Teeswater. I'm trying to keep all the business associated with it locally. We've had a donation of the gym in town here to be available for all the Snowbirds to use if they are not happy with the facilities at the hotel. I booked 519 restaurant for an after-party reception by the Snowbirds. I've also booked a hotel for a meet and greet, which is going to be part of our fundraiser to do this. I've got limited tickets of $200 I can sell to the public, and I've got 50 tickets set aside to hand to sponsors or for the personnel that want to attend. This is a 2-hour opportunity for people to meet the Snowbirds in person, and they'll be at the hotel and in the reception area to meet and greet and mingle with the public. What else can I tell you? I'm hoping to go to every council in Bruce County, all your councils approach you as well. I've also approaching some of the major industries in town for funding also. Now, some of that has changed in the last 24 hours. Pardon me. The program, I've worked a proposition out with the Walkerton Herald Times that they produce a program, limited programs given to me. They look after all the advertising and hunting for it. The committee gets the programs to sell, and that's going to be part of our revenue. The other revenue is going to be the parking at the airport. It takes about $24,000 to put this on. As I said, $4,000 has been donated in vehicles by Leslie Motors, and I'm hoping that you will come across for the hotel expenses for the snowbirds, and I'll raise funds for the rest myself with my committee. In the meantime, if you have any questions, I'm happy to answer them. We've also had some publicity already. This is the Herald Times from today's Herald Times with John's granddaughter gracing the front page, and a center spread of the Snowbird aircraft. I know the Post is putting out an article as well. It has an article in it last week with a press release that I sent you as well. And the Old Sound Sun-Times has also published something about this event. So there's lots of talk. All the response I've had from people is they're positive that the snowbirds are coming for the first time since 2004. And Mr. Crutchfield was the chair at that time as well. Anyway, I'd like to leave you some pins. I may come around, Mr. Warden.
Sure.
Okay, these are COPA pins. By the way, I'm a COPA director as well, Canadian Owners and Pilots Association for Ontario.
Thank you, Phil.
Thank you, sir. Can I give you one too? Thank you much.
So does this mean we have our wings now, Phil? All right.
You can fly the computer.
Okay. So at this time, I think we would open it up for some questions from County Council. David?
Well, not a question really, but as you can see, Phil has a great deal of enthusiasm. Being part of the Airport Commission out there, we really value our volunteers, and they've taken hold of this, and I know they'll all do a great job. This is something that the Commission has dreamed of for the last few years, as Phil said, and they bring a lot of people. I've heard that up to 5,000 people show up for these snowbird performances. The planes fly to music. I guess they put up speakers and they do all kinds of fancy tricks. So just wanted to recognize the volunteers that are working towards this project.
Good. Thank you, David.
Thank you, Mr. Inglis. I'd like to say that all Bruce County citizens and residents can benefit from this. Also, all Bruce County businesses can benefit from this. And that's my main motivation for this as well, to promote Bruce County, let the rest of Canada and the world see what a great place Bruce County is to live in and work in. Thank you so much.
Thank you very much, and we will have a discussion at some point about how we might be able to help you, Phil.
Thank you, sir.
Okay, thank you. Have a good day.
Thank you, Mr. Warden.
Okay, county officer reports. Any county officer reports this morning? Hearing or seeing none. Inquiries and announcements. Any inquiries or announcements this morning? I have one. I would ask Mr. Eagleson to please come up to the front. The Bruce County plowing match was held obviously this past summer, and somehow the trophy has arrived here at Bruce County, and I have been asked to make the presentation to Paul, who has won the championship, and he was the only one in it. So I might too, and I didn't win, so.
Congratulations. Thank you very much.
Well, I see your name was on there before. So. Okay, moving on to minutes.
I have a motion moved by Councillor Eagleson and seconded by Councillor McKeever that the minutes of the following committees be approved. January 6, 2017, Executive Committee, Corporate Services Committee, Highways Committee, Homes Committee, Human Resources Committee, Museum Committee, Paramedic Services Committee, and Social Services and Housing Committee. January 19, 2017, Executive Committee, Highways Committee, Human Resources Committee, and Planning and Development Committee.
Are there any errors, omissions, or discussions from any of those minutes? Hearing none, all those in favor? Opposed, if any, that is carried. Thank you. Unfinished business this morning. Seeing none, bylaws. Donna?
I have a motion moved by Councillor McKeever and seconded by Councillor Eagleson that the following bylaws be adopted. 2017-012 is a bylaw to adopt Amendment Number 209 to the County of Bruce Official Plan. Bylaw 2017-013 is a bylaw to adopt Amendment Number 208 to the County of Bruce Official Plan. Bylaw 2017-014 is a bylaw to adopt Amendment Number 214 to the County of Bruce Official Plan. Bylaw Number 2017-015 is a bylaw to adopt Amendment Number 215 to the County of Bruce Official Plan. Bylaw Number 2017-016 is a bylaw to authorize the execution of an extension of lease agreement with Joseph Wyshun and Joanne Wyshun Lee to provide rental space for a Bruce County ambulance station in Port Elgin. Bylaw Number 2017-017 is a bylaw to confirm the proceedings of the Council of the Corporation of the County of Bruce at its meeting held the second day of February 2017.
Are there any discussions on any of those bylaws? Hearing none, all those in favor? Opposed, if any, that's carried. Thank you. Motion.
I have a motion moved by Councillor Smith and seconded by Councillor McKeever that we adjourn to meet again Thursday, March the 2nd, 2017 at 9:30 a.m.
All those in favor?
Okay.